Anterior pelvic tilt and lumbar lordosis isn't as common as posterior pelvic tilt and kyphosis, which features in one of our other videos. Users may complain of back pain or discomfort, which is predominantly due to being unable to make contact with the backrest or back support when seated. This posture also affects stability as it alters the user's center of gravity, moving it forward and away from the wheelchair's center of gravity. This makes the user far less stable in the chair. To stabilize themselves when seated, users commonly fold their arms and place them on their thighs or their laps to prevent them falling forward. The armrests on a wheelchair offer insufficient support, as the user's posture means the armrests are situated too far behind them for them to use. As with all postural issues, anterior pelvic tilt and lumbar lordosis can be a result of issues relating directly to the configuration of the wheelchair, clinical issues relating to the user, or a combination of both. Common reasons why a user might adopt this posture is because the back support is too upright, or there may be too much cushioning or contouring in the lumbar region of the back support, which pushes the pelvis forward, causing lordosis of the spine. Clinical reasons for this postural presentation can include tightness of the hip flexor muscles, which, when tight, will pull the pelvis forward, or shortening of the lower back muscles, which prevents the user from bringing their trunk back over or in line with their pelvis. Obesity can also be a contributing factor, or pregnancy, as excess weight in the abdominal region will pull the pelvis forward. A contoured cushion is always recommended, no matter what a user's postural presentation is. Sitting on a contoured cushion may be enough to help correct a mild flexible anteriorly tilted pelvis, but if not, a modular seat cushion with accessory parts is a good solution to try. When attempting to correct flexible anterior pelvic tilt and lumbar lordosis, start by trying different seat angles with the user. Adjust the angle of the cushion by placing a wedge under the front edge. This will help reduce or close the angle of the pelvis, encouraging it to rotate backwards towards neutral. Altering the seat angle can also be done on the wheelchair itself by repositioning the rear wheels on the rear wheel axles, or by changing the size of the rear wheels themselves. The position of the front casters must also be changed, and the angle of the casters checked to ensure they're perpendicular with the floor. When it comes to determining the correct position of the back support, place the back support at the level of the posterior superior iliac spines, also known as PSIS. This should help reduce the lordosis, but only after the right seat angle has been found. It's important to obtain the right seat and pelvic angle first, so that the back support can work in combination with the cushion to keep the pelvis in an optimal position. If further postural control is required, a secondary support, such as a pelvic belt, can be used. Fit the belt across the anterior superior iliac spines, also known as ASIS, at a 45-degree angle. This will encourage the pelvis to rotate backwards towards a neutral position. A 4-point pelvic belt may give more aggressive correction if needed. Again, attach the main strap of the belt across the ASIS at a 45-degree angle. Then attach the remaining straps at roughly a 90-degree angle. An anterior trunk support can also be effective in helping control unwanted forward movement of the trunk. Secondary support should only be fitted once the back support, cushion and wheelchair have been adjusted and configured optimally. It's important to remember to never fit a harness without using a pelvic belt first. The pelvis must always be stabilized first, otherwise you risk causing injury to the user. When it comes to accommodating a fixed anterior pelvic tilt and lumbar lordosis, again, use a contoured modular cushion with accessories to bring the trunk over the pelvis and achieve a more upright posture. Positioning the back support at the level of the PSIS will not be effective, as the pelvis is fixed. Therefore, the back support must be raised above the level of the PSIS and moved inwards towards the user. Replacing the existing backrest canes with 90-degree backrest canes may give further help in bringing the wheelchair back and closer to the user. Ensure any remaining space between the user and the back support is filled by fitting lumbar support pads. This helps prevent peak pressure buildup and ensures effective pressure redistribution. For more information on how to correct or accommodate for other common postural presentations, please see our other videos.